Thanks for making it to Veterans Info Tap. I'm really glad you made it. Today I wanted to talk to you about the Civilian Health and Medical Program of the Department of Veterans Affairs. This, again, the Civilian Health and Medical Program. This is for your dependents. This is for your spouse, your children. This is a health insurance type of a program for our dependents. Now, what I wanted to do was read through a few things for you, give you a little bit of highlights, do a couple Q&As for you, and give you a little bit of insight on this program. So you may not have heard of it that way before, the Civilian Health and Medical Program of the Department of Veterans Affairs. It's a mouthful. You may have heard it, CHAMPVA. CHAMPVA is a health benefit program in which the Department of Veterans Affairs shares the cost of certain health care services and supplies with eligible beneficiaries. I'm going to read a few things here off the VA's website, and then we'll jump into some Q&A on it. So CHAMPVA benefits. Again, this is off the VA's website, so straight from the horse's mouth. Hit the thumbs up for me, subscribe, share with a friend. Consider being a member if you're not, and to all your members, thank you so much for your additional support. It really means a lot, and I appreciate it. All right, so are you the spouse or surviving spouse or child of a veteran with disabilities or a veteran who has died? If you don't qualify for TRICARE, so that's the big one, right? If you already qualify for TRICARE, you're solid. So if you don't qualify for TRICARE, the Department of Defense's healthcare program for active duty and retired service members and their families, you may be able to get health insurance through the Civilian and Medical Program of the Department of Veterans Affairs, otherwise CHAMPVA. Through this program, we cover the cost of some of your healthcare services and supplies. This is called cost sharing. Find out if you qualify for CHAMPVA and how to apply. Am I eligible for healthcare through CHAMPVA? You may only be eligible for healthcare through CHAMPVA if you don't qualify for TRICARE and at least one of these descriptions is true of you. And they have a few bullet points here. At least one of these must be true. You're the spouse or child of a veteran who's been rated permanently and totally disabled for a service-connected disability by a VA regional office. So in other words, you're 100% permanent and total. Again, in the VA's world, permanent means that all your conditions, or at least enough of your conditions, are considered static, meaning they have no chance really of getting better. And you are total, which means that you're at the 100% rating. So that's one option. So if the veteran is 100% permanent and total. The next option is you're the surviving spouse or child of a veteran who died from a VA-rated service-connected disability. Now, probably like dependency indemnity compensation, it doesn't have to be the specific cause of death. The service-connected condition could be listed on the death certificate as a contributing cause to death. So an example would be a veteran died of a heart attack, had no heart issues rated with the VA, but they did have a circulatory issue in the legs rated with the VA. That circulatory issue could be added onto the death certificate as a contributing cause to the heart attack, making the surviving spouse eligible for specific benefits. The next option here is you're the surviving spouse or child of a veteran who has, at the time of death, that they were rated permanently and totally disabled from a service-connected disability. So if the veteran passed away and they were already 100% rated with the VA for permanent and total. Next is you're the surviving spouse or child of a service member who died in the line of duty, not due to misconduct. In most cases, family members in this situation would qualify for TRICARE, not CHAMPVA, but for the off chance, this is an option. A service-connected disability is a disability that we've concluded was caused or made worse by the VA or Veterans Active Duty Service, rather. A permanent disability is one that is not expected to improve. In other words, it's static. Note that a veteran who is qualifying for CHAMPVA a sponsor for their family may also qualify for the VA healthcare program based on their own veteran status. If two spouses are both veterans who qualify for CHAMPVA as CHAMPVA sponsors for their family, they both may now qualify for CHAMPVA benefits. Each time they need medical care, they may choose to get care through the VA healthcare program or use their CHAMPVA coverage. Interesting. What else might affect whether I can get CHAMPVA benefits for myself or my family? So here is some of the things. There are other factors that may affect whether you or your family members qualify for CHAMPVA. Please click on the description that matches the status to learn more. If you're a new or expected parent, if you're expecting a baby, you'll need to take 2 steps to apply for the newborn baby. It's a Social Security number, and the baby must be listed as a dependent through the VA. What's another one? An 18 to 23-year-old dependent of a veteran. If you're covered under CHAMPVA and you turn 18 years old, you'll need to send the VA proof that you're enrolled in college or another educational institution to keep the benefits. Let's see, a veteran's stepchild who leaves the veteran's household. If you were covered under CHAMPVA as the stepchild of a veteran and you leave the veteran's household because of a divorce or remarriage, you no longer qualify for CHAMPVA. A primary caregiver for a veteran with injuries and or disabilities. If you're a family member caring for a veteran with disabilities, you're not entitled to care or services through another plan, then you may qualify for CHAMPVA. So if you're not entitled to care or services through any other plans, you may qualify for CHAMPVA. So that's a few of those. What kind of stuff is covered through CHAMPVA? Covered services include ambulance services, ambulatory care, durable medicine, medical equipment, family planning and maternity, hospice, inpatient services, mental health services, outpatient services, pharmacy, skilled nursing care, transplants. When you're signed up for CHAMPVA, you'll get a copy of the CHAMPVA program guide. This guide will tell you more about covered and non-covered services and supplies. How do you get it? You would fill out the application. It's a fairly simple application. The application for CHAMPVA benefits is the 1010D, Delta. 1010D is in Delta. The regular 1010 is for you as the veteran getting healthcare services through the VA. So it's just another health services form, but specific to CHAMPVA is the Delta designator. So 1010D. And then you would also submit the other health insurance certification, which is VA Form 107959C is Charlie. Again, 10-7959 Charlie. And then that would let the VA know if you have any other applicable health insurance, and then documents related to your Medicare status if applicable. And all the instructions are going to be there on the forms for you as well. What I wanted to touch here on was a couple Q&As that I found on CHAMPVA benefits, just to run through there. So what is the cap for CHAMPVA? So there's a $3,000 per CHAMPVA. The catastrophic cap is a cost cap or upper limit for our for out-of-pocket medical expenses incurred by CHAMPVA beneficiary in a calendar year. The annual cap on cost sharing is $3,000 per CHAMPVA eligible family in a calendar year. So that's what I'm reading, and it sounds like it's the entire family. So $3,000 for the family, so not per person. What is the monthly cost of CHAMPVA? There is no premiums. The coverage is free. However, there are deductibles and copays associated with using this coverage. After an annual deductible of $50, the participant pays 25% of the covered amount. So again, it's a cost-sharing health coverage option for you. Another question here, does CHAMPVA cover 100%? CHAMPVA helps pay for covered medical care, but it does not cover 100% of costs. According to the CHAMPVA guide, enrollees are responsible for an annual deductible along with their share of the allowable amount. The deductible is $50 per beneficiary with a maximum of $100 per family and is applied each year. Let's see, what's another good one? We'll do one more. What does CHAMPVA not pay for? CHAMPVA will pay for Medicare and other insurance such as Medicare HMOs and medical supplemental plans for healthcare services and supplies. CHAMPVA does not pay Medicare Part B premiums. Let's see, let's find one more. Can I use CHAMPVA as my primary insurance? CHAMPVA is not considered primary health coverage. Find resources and information about Medicare disability benefits. Can you use any doctor with CHAMPVA? CHAMPVA shares the cost of certain medical necessary procedures and supplies with eligible beneficiaries. We do not have a network of healthcare providers, so you can visit most authorized providers. And last one. Does CHAMPVA pay for medications? CHAMPVA will pay for Medicare drug plan co-payments of up to 75% of the CHAMPVA allowable amount for prescriptions. If the person has a Medicare drug plan, Medicare is the primary payer and the other health insurance is the secondary payer. All right, with that, we'll go ahead and conclude it there. A lot of good information on CHAMPVA. I hope it helps. Have a great one. And remember, if we don't take care of each other, something went wrong.